I'm Dr. Frita, and today I'm giving you the 7 best foods for chronic kidney disease. Kidney doctor approved. I am a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. And one of the most shocking things I find when I'm seeing patients is how surprised they are at what a very important role what you eat has on your kidney health. It's true. So your kidneys are responsible for filtering out excess waste and water and toxins. They're also very important for you balancing your electrolytes, like your salt, your potassium, your magnesium. When your kidneys stop working the way that they should, you get a change in certain numbers on your labs. So if you just go ahead and look at your labs, grab my chart, grab your labs online. If you look at your kidney labs, BUN, creatinine, eGFR, if those are marked as abnormal, then there's a great possibility that you have a decrease in your kidney function. And if you have abnormal kidney tests or a decrease in your kidney function that lasts for at least 3 months, we call that CKD, chronic kidney disease. Now here's the thing. Over 35 million Americans have chronic kidney disease, and most don't even know it. And that's because oftentimes the symptoms are silent. There are certain things that can predispose you to having CKD, certain risk factors, like if you have a family history, if you have diabetes, that's the #1 cause of CKD. Also, if you have high blood pressure, if you take certain medications that are toxic to the kidneys, if you're dehydrated, and if you develop glomerulonephritis or certain genetic predispositions that hurt your kidneys. Nevertheless, despite how common CKD is, it's also in many ways preventable, and we can even slow down its progression. One of the most important ways to slow down the progression of CKD is to eat the proper foods. Yes, to eat foods that help to reduce inflammation in your kidneys, to eat foods that help to slow down the waste buildup from the kidneys not filtering properly. I take care of kidney patients every day, and I can tell you from firsthand experience, I've watched them actually gain improvement in their kidney function, largely due to eating the proper foods. And so now I'm going to give you an inside scoop. As a kidney doctor, I'm going to give you 7 of the best foods for chronic kidney disease. Keep watching. I love giving you health information like this, but if you want to talk to me more in depth, if you want to talk to me one-on-one, I actually offer a telehealth concierge service. That way, I can speak to you from anywhere in the world. Once you book an appointment, I can get a full history and I can give you a second opinion. I can give you a first opinion on your health issues. Not only am I a board certified kidney doctor, I have also been board certified in internal medicine, pediatrics, and I am board certified in obesity medicine. If you feel like talking with me one-on-one can enhance your health, be sure to click the link in the description or go to my one-stop shop, dr.frita.com, and book your telehealth concierge service with me today. Please be sure to go ahead and hit that thumbs up. Give us a like and subscribe because I'm about to give you some evidence-based medical information. Let's go ahead and get started. Here are my 7 best foods to eat if you have chronic kidney disease. #1, cauliflower. Yes, cauliflower. Let me tell you, this is really a power-packed food because it is low in potassium, low in sodium, low in phosphorus. And if you have CKD, especially if it's advanced CKD, then you might have an issue with high potassium. Why? Because your kidneys are responsible for filtering out excess potassium. And so for many of my patients, especially if they have advanced CKD, then they might end up with hyperkalemia, high potassium. If you have high potassium, this is a problem because high potassium in the blood can lead to abnormal heart rhythms. It can even make the heart stop, and so it's very serious. Also, when you're dealing with sodium, of course, if you have high sodium, that causes your body to hold on to excess water, and that can worsen your high blood pressure, and high blood pressure is the #2 cause of kidney failure. And so if you have CKD, you definitely want to watch the sodium. Cauliflower is low in sodium. Why is it being low in phosphorus important? Well, again, kidneys are responsible for getting rid of excess phosphorus. And so if you have advanced CKD, then it is often recommended that you limit the phosphorus in your diet. For my patients with advanced CKD, and especially for patients who are already on dialysis with end-stage kidney disease, I recommend that they limit their phosphorus intake to less than 800 milligrams per day. And listen, a lot of the foods that we eat really are loaded with phosphorus, especially if you're eating prepackaged, ultra-processed foods, which I recommend that you not do. Either way, when it comes to this food, cauliflower, you don't have to worry about that because it's low in potassium, low in sodium, and low in phosphorus. Guess what? Cauliflower is high in fiber. It's also high in vitamin C. And we know that these items help to support your immunity and your digestion. If you have a diet that's high in fiber, that is a way to kind of help you to regulate your digestive system. It can also help you to maintain a healthy weight by getting full with the bulk of this low-calorie cauliflower. The fact that cauliflower is high in vitamin C is important because vitamin C helps to enhance your immune system. It helps you with your white blood cell production. And if you happen to get a cold, having high vitamin C in your system can help to shorten the duration of your cold symptoms. So here are some ways I suggest that you incorporate this wonderful CKD-friendly food into your diet. Try having mashed cauliflower. I definitely do this all the time. You just boil the cauliflower till it's soft, mash it up, and you can use mashed cauliflower and it can replace mashed potatoes. And of course, we know that white potatoes are high in potassium, and so this is a good substitute. You can also use cauliflower to replace certain things like rice, okay? White rice and brown rice can be replaced with cauliflower rice. Or you can just eat cauliflower the way that it is. You can, look, I actually enjoy eating cauliflower all by itself, or I might dip it in a little low-calorie type of a dressing. Or you can slice your cauliflower and you can saute it in olive oil, add a little garlic, and you can have it as a side to other healthy foods like fatty fish, like salmon, which is another food we'll get into. Either way, eating cauliflower is one of the best things you can do to support your kidney health. Number 2, bell peppers. Yes, and don't y'all just love all these delicious, colorful bell peppers that I have? Bell peppers are wonderful for supporting chronic kidney disease because, for one, they're naturally low in potassium. We know that's helpful. And they're also high in vitamin A and vitamin C. And these are vitamins which help to support immunity. They're high in antioxidants. Bell peppers also help to support heart and kidney health. And because bell peppers are full of so much vibrant flavor, they are an excellent way to flavor your foods without having to add salt. So here are some ways you can incorporate bell peppers into your diet. You can slice red peppers into strips and you can add them to your salads, or you can, get yourself a nice low-calorie, low-fat dressing and dip the red bell peppers there. Or, and this is what I did just the other day, you can slice your red peppers and saute them with red onions, with garlic, and you can add them to a white meat chicken, skinless of course, or you can add them to another fatty fish like salmon or mackerel or halibut, and that will create a whole CKD friendly meal. Another way to mix up your antioxidants is to add to the colors. Combine red and yellow peppers, orange if you like, okay? Eat the rainbow. However you eat them, bell peppers are an excellent way to promote CKD health. Question: what's one recipe or food swap which helps you maintain kidney health? Please comment down below. Number 3, garlic and onions. Yes, I love garlic and onions, and guess what? So do your kidneys. See, garlic and onions, it's just a really great way to enhance your kidney health because garlic and onions will add flavor to your food and they can help you to decrease the amount of salt you add, okay? You don't need salt for flavor. Garlic and onions are completely rich. And guess what? They also support kidney health by helping to reduce your blood pressure naturally, and they support good circulation. They're loaded with antioxidants and anti-inflammatory properties. And here's something really neat. With garlic in particular, it contains a substance called allicin. Allicin helps your blood vessels to soften and relax, which allows you to have a better circulation and a lower blood pressure. It's true. So, of course, you can enhance garlic and onions all kinds of ways for your food. I love to slice them up and saute them. Not too much. I don't want to cook them to the point where I denature the substances that are actually kidney healthy. But I saute them lightly with olive oil, and I'll add them to my baked or grilled fish. I'll add them to my baked or grilled chicken. I'll add them to roasted vegetables for sure. You can also take garlic and onions, slice them up, and add them to olive oil for a healthy, flavorful salad dressing. I definitely will mince garlic and onions and add it to any one of my soups, salads. I'll add it to my avocado. Garlic and onions are an excellent, flavorful addition to any diet, and they definitely support kidney health. Number 4, blueberries and cranberries. Okay, these are some of my favorite foods, and they're really great for kidney health because they're full of antioxidants which fight free radicals, and they're also great for your urinary tract health. So take blueberries. Blueberries are one of my favorite fruits. Yes, they're very high in antioxidants, they fight free radicals, and they help to decrease inflammation in your kidneys, which of course supports your kidney health. And when it comes to cranberries, and I'm talking about fresh cranberries, not dried cranberries. Fresh cranberries are really great in supporting your urinary tract health. Like, have you ever eaten a cranberry and you notice that it has that kind of a resin, like that gritty kind of a texture to it? Well, this gritty texture is caused by the cranberry resin, and what it does when you eat cranberries, then this resin, once it's in your bladder, helps to bind to certain bacteria. And so if you have bacteria that have crawled up your urethra and they've gotten into your bladder, if they meet the resins of the cranberries, then the cranberry resin will help to bind to the bacteria and drag them out of your urinary tract system. Of course, consult with your doctor if you're having any symptoms of a UTI, like burning when you use the restroom, or urinary frequency, urinary urgency, a foul smell to your urine. Consult with your doctor because very likely they will want to give you an antibiotic. But I will say that eating cranberries in many ways won't hurt, might help. Another way I like to enjoy my blueberries and cranberries is to mix them up with Greek yogurt and put them in the freezer. Sometimes I'll get those like ice cube trays and put a dollop in each tray, and that gives me that nice consistency of ice cream, but it gives it a healthy, kidney-friendly spin. Number 5, apples. Okay, can I be honest? I had apples, and my 9th grade daughter literally ate the last apples this morning. I didn't know it. I'm not even kidding. Because here's the thing, I pull these foods out of my refrigerator because I really do eat them every day to support kidney health and heart health. But listen, y'all know what apples look like. Apples are a wonderful food to support kidney health. They are naturally low in sodium, low in potassium. They're also great for digestion. Apples contain pectin, which helps to lower cholesterol and to lower blood sugar. They are loaded with fiber, which again helps to support your digestion. And in general, apples help to support not only kidney health, they help to support heart health as well. The thing is, apples are delicious and they're crunchy and they're wonderful, very popular in my house. You can eat apples as they are. You can slice them, you can add them to Greek yogurt, you can actually bake apples and add a little cinnamon. That's a good healthy snack. You can dice apples up and add them to a salad for crunch. Apples are an excellent way to support CKD health. Number 6, fatty fish like salmon, also mackerel, sardines. I'm not talking about sardines and a bunch of salt or oil. Choose sardines that are in water, okay? Now, the reason that fatty fish is so great for kidney health is because fatty fish are loaded with omega-3s, okay? Omega-3 fatty acids. And these are great for kidney health and heart health. Omega-3s help to reduce blood pressure. They help to improve vascular flow, including the vascular flow to your kidneys. Omega-3s also help to reduce triglycerides. And they just are really great for heart health. And of course, having great heart health will support great kidney health. Another wonderful aspect of having fatty fish in your diet is that it's an excellent source of protein, and it actually tends to be healthier than other protein sources like red meat. So how do you incorporate fatty fish into your diet? You already know. I definitely grill my salmon, okay? Or I bake my salmon. I add garlic, I add onions. I'll put a side of cauliflower rice on the plate, okay? Definitely red onions, bell peppers. You get my drift? There's a great way to have a wonderful kidney-friendly diet using fatty fish and incorporating these other foods as well. Number 7, olive oil, okay? Olive oil. This is a healthy fat that helps to enhance your kidney health as well as your heart health. Olive oil has monounsaturated fats as well as antioxidants. It helps you to absorb nutrients and to even balance cholesterol. And I love olive oil because you can incorporate it in so many ways while helping to promote your kidney health. I use it to cook, okay? I drizzle it when I'm sauteing and I use olive oil instead of butter. I also use olive oil for my salad dressings. I'll mince garlic, I'll chop up onions, and I'll mix it with olive oil for a delicious kidney healthy salad dressing. I also drizzle olive oil over my roasted vegetables. I'll drizzle it over my salads. I'll add garlic to olive oil and put it over just about anything. So yes, make sure you grab olive oil as an excellent way to enhance your cooking and a way to have improved kidney health. Question: which one of these kidney-friendly foods is already a part of your regular meals? Comment down below. So there you have it. Here are 7 of my best food suggestions in order to improve your kidney health, okay? Best foods for chronic kidney disease. And this list is not exhaustive. There are even more foods than this. Make sure you check out my video on 15 foods to help repair your kidneys after you finish watching this video. What I love about these foods is that, as I said, I grab them right out of my refrigerator. They are delicious, they're tasty, they give you a variety, and it goes to show that with small, simple steps, you can actually have a diet that is kidney healthy. Always be sure to consult with your doctor and your registered dietitian. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about. As always, I appreciate you for your support, and I will continue giving you evidence-based, helpful medical information. Do your best to continue living your healthiest, happiest life. I'm Dr. Frita.